So attending for pregnancy care at the Scotia clinic means that we see you for your first visit at around 12 weeks of pregnancy after your GP has referred you in. That visit's a very crucial visit. The first thing that we would do is do an ultrasound scan, and that tells us how many babies there are, that the heartbeat is okay, and it confirms the dates as well. So that's the most important and exciting part of the visit for people. Then we often do blood tests and swabs depending on things. And the next step then is to have your detailed history taken, your medical history. Nowadays, with restrictions with COVID and everything, we often do this online, and we have secure software that we can use for that, or we can do a telephone consultation if that suits people better. And it means that they can have their scan and go home. One of the problems with COVID was it was identified that people doing ultrasound scanning are more at risk of acquiring COVID. So there were restrictions put in place to stop partners coming in, purely to limit the number of people in a clinic. But now that we have A, vaccines, and B, separating the scan out, it's a little bit easier to allow partners to come in and be part of the first scan. If for whatever reason they can't come in because they're cocooning or whatever, then we can FaceTime the scan, or we're webcamming the scans so that the scans can go home to them. So the second part of the next part of the antenatal care is looking at the anatomy of the baby, and more we're bringing that scan that used to be called a 20-week scan forward to maybe 14, 15, 16 weeks. And with 3D ultrasound, that allows us to see the anatomy of the baby a lot more. So we can do an awful lot of the anatomy scan earlier, and then just look at the baby's heart in more detail at a later stage. So the next visit then to us would be at about 28 weeks. And in between times, you're having shared care with your GP, because that's how it works in this country, that you combine care with your GP and your obstetrician. So we tend to see people about 28 weeks, then again at 32 weeks. And the 32-week visit is really quite pivotal, because often if a baby's growth is going to be a little bit reduced or a little bit excessive, that will often manifest around that time. And also it gives us a chance to repeat your blood tests. And the other important thing about 32 weeks is that's the time when people are kind of realising the inevitability of the pregnancy, and we'd like you to be doing your antenatal classes, all of which we have online now in our patient portal at the Scotia Clinic website. And that gives us a chance to talk to you about issues that might have come up in the classes. I think it's particularly important to do the breastfeeding class around that time, because if people are looking at colostrum harvesting or whatever, then they need to be planning for that at that point. So yeah, 32-week visit, really important visit. And again, back to your GP for a while, then we see you with 36 weeks, 38 weeks, 39 weeks, and thereon from your due date. Now, there are circumstances where we might see people more frequently. It might be with a twin pregnancy that you need way more scans to assess baby growth. It might be that the baby's breech or a little bit smaller or a little bit larger. So all of that is dependent on what's happening at each visit. So it's risk assessed, it's tailor-made. Then when you come into us in labour, which will be to Ardfert ward in University Hospital Kerry, the midwives will be linking in with me and looking after you, and we again liaise with the care there. And after the baby's born, we have some patients doing early discharge from hospital, but we have people staying for the full length of stay, and then back to us for a 6-week visit. And during that 6 weeks, you have access to us by day through the phone, and by night through the hospital emergency numbers if there's any issues arising. And we have 2 paediatricians on the staff who will help with the baby if there's any problems with the baby. And we have our lactation consultant, Anna O'Donoghue. If you're breastfeeding and running into problems, she's at the other end of a phone for us to contact if you need help with that. So the other thing just to be aware of is that between visits, things can happen that worry people. Sometimes they feel the baby isn't moving as much as usual, and if that happens, they can contact us by day or out of hours. The Ardfert ward in the hospital, they might be brought in for a scan or a fetal heart tracing, and if that's reassuring, they'll be able to go home, and most of the time it is reassuring. Sometimes people come in because they've had some bleeding, And again, that's about having an assessment, having a scan, and making sure that everything is okay. It's particularly important if we know that you have a low-lying placenta, or we know you're rhesus negative and are likely to need anti-D. Very, very important. And even just having any kind of an accident where you have a seatbelt injury or someone bounces off the bump, maybe a toddler at home, if you're rhesus negative, anti-D may be important and you should come in. Also, between visits, people might think their waters have gone. We have tests that we can do to check that out, and if everything's okay, you can go home. If everything isn't okay and the waters have gone, then you'd be staying in and we'd manage that appropriately. It might be that you feel that you're going into labour because you're having contractions, and again, always Ard Ward and the maternity unit are on the other end of the phone to help out with any of those problems. Equally, after the baby's born, people might have problems with bleeding, pain in their stitches, and there are emergency numbers and pathways of care to help you out with all of that. And we have all of those numbers for you.